Head cancer is a group of cancers starting in the squamous cells lining the mouth, nose, throat, and sometimes the salivary glands. The most common type is squamous cell carcinoma. These cancers matter because they directly affect breathing, swallowing, and speaking, and can spread quickly to nearby lymph nodes. Early detection improves outcome. As practical nurses, we are often the first to see a non-healing ulcer, lumps, voice changes, or swallowing difficulties during care. So we play a key role in early recognition and support and reference. Most begin as a change in the epithelial lining and progress to invasive carcinoma and can metastasize through the lymphatic system. John Patrick is a 58-year-old construction worker. He reports trouble with swallowing, bad breath, and weight loss. He has a non-healing ulcer on his left lateral tongue for past 4 weeks. A breast biopsy was done and confirmed squamous cell carcinoma, and he is waiting for surgery coming month. His history includes smoking 2 packets of cigarettes for 30 years per day and drinking about 6 standard shots of whiskey 270 ml on weekends. He lost 7 kilograms of weight over the last 2 months, that is 85 kilograms to 78 kilograms. And this squamous cell carcinoma spread early through lymphatic system. So we should prepare him for surgery and oral hygiene and watch closely for airway compromise and support his nutrition. In terms of etiology, squamous cell carcinoma of the tongue happens when the normal lining cells change into dysplasia and progress to carcinoma in situ and then invade deeper tissue. For pathophysiology, because the side of the tongue has a rich lymphatic supply, this cancer spread early to nearby lymph nodes. Looking at the risk factors, long-term smoking, alcohol use, HPV virus, poor oral hygiene are big ones, and John has several of these. And his father had cancer of the tongue. So his first degree relative is having cancer. And for the clinical manifestation, we can see a non-healing ulcer, pain on difficulty in swallowing, persistent bad breath, and weight loss, which John is experiencing now. In 2024, about 8,100 Canadians are expected to be diagnosed with head and neck cancer, and about 2,100 are expected to die from it. In Prince Edward Island, about 40 new cases and 50 deaths are projected this year. In that, 30 are males and 10 are females. And in the death, it is 10 males and 5 females. During the nursing assessment, John's airway is clear and his respiratory rate is 18 and the effort was normal and the oxygen saturation was 95% on room air and he has pain like 2 out of 10 scale and it is dull and irritating and oral mucosal lesion that has it is a red color is there and there is little edema around the ulcer and there is no discharge but there is clot present on the ulcer and the size of the ulcer was 4 centimeter into 2 centimeter into uh, uh, 1 centimeter depth and he got actually the lymph nodes that is palpable on right and left submandibular nodes were palpable and swallowing he has actually difficulty in swallowing thick food and he cough when he is taking food and his voice there is no hoarseness and nutrition and he lost actually 7 kilograms in the last 2 minutes and he reduced his food intake during this time. And he has a little body image because of his halitosis, and he had a grief because of his diagnosis of chemical carcinoma, and he was actually little depressed because of this diagnosis and the coming surgery. During intraoral examination, we inspect lips, buccal mucosa, gums, palate, tonsillar area, floor of the mouth, and lateral tongue for lesions. We document size, color, edges, and induration with RIGA, that is redness, edema, erythema, discharge, and approximation, and note any tenderness. This step-by-step help us detect changes early and plan safe care while the patient awaits surgery. For diagnosis, we use both tissue sampling and imaging. Brush, punch, or incisional biopsies take cells or tissue samples for pathology. Then we use laryngoscopy endoscopy to directly visualize the area if it is in the throat, and CT or MRI scan to see how far the cancer has spread. So these together confirm diagnosis and guide treatment planning. Three main treatment approaches: chemotherapy, usually given through an IV and work throughout the whole body to slow or stop spread of the cancer. Radiotherapy uses a very precise beam focused on the tumor area to shrink or control it. Surgery involves physically removing the tumor and the surrounding tissue to prevent recurrence. As nurses, our role is to help manage side effects, support healing, nutrition, and prepare the patient emotionally for each step. John's priority nursing diagnosis is impaired swallowing from his tongue tumor because it directly affects airway safety. A secondary diagnosis is imbalanced nutrition due to decreased intake and weight loss. As his nurse, I will educate him to sit upright for meals, teach safe swallowing, monitor tolerance to a soft diet, work with a dietitian for high calorie soft food, and track his weight twice a week. The references are cited from Cancer Journal of Clinicians and Canadian Cancer Statistics Advisory Committee Project and Radiopedia and Oral Oncology Journal.